My name is Shay Maunu and I'm a registered nurse. I decided to become a nurse with absolutely no clinical experience. I had never worked in a hospital, worked in even a kitchen in a hospital, but it was really what I wanted to do after the experience of having my kids. So there's different levels of nursing. From, I think the lowest level is probably a licensed practical nurse. Their scope of practice is a little bit limited. And then we have our registered nurses. We have nurse practitioners. We have doctorates in nursing. And then within each of those, there's like about 90 different specialty nursing. You can go into oncology, pediatrics, cardiology, rehabilitation, and about 85 others. I think there's a lot of different areas people don't realize are available in nursing. You have your clinical side and then non-clinical side. So clinical side, I think, is what most people think about. You know, the nurse with their stethoscope, holding their patient's hands, walking them through a procedure type of thing. And then on the non-clinical side, there's an unlimited amount of opportunities, really. You could do education. If you enjoy education, you can educate patients, you can educate staff, you can be a legal consultant, you can be a researcher, you can go into administration. The really possibilities are kind of endless. My husband and my family thought I was crazy when I was like, hey guys, I'm gonna become a nurse. I'm gonna quit what I've been doing for 15 years and become a nurse in my 30s. So I first started looking at community colleges that required a lot of prerequisites, and I hadn't been to college in 10 years or more, so I didn't have a lot of the current prerequisites that were required. So I started looking at some of the for-profit private schools, and that's the route I decided to go. After I found the school, I had to find some financing because it was expensive. And so going through the financial aid process as an adult was a little bit challenging, I think. And then from there, really taking the test to get into the program and starting the program and finding a way to find a work-life balance between school and my family at home. One of the biggest ones, I think, is that nursing is only for women. Completely false. I think maybe the last statistics I saw said, I think in 2014, like 7% of nurses were male, which doesn't sound like a lot, but it's a huge improvement from like 1970 when it was like 1%. So that was kind of a big deal. Another misconception is that people go into nursing because they can't be doctors. Becoming a nurse is a willful choice, for sure, and doctors kind of treat the disease and nurses treat the patient, and so you really have time to connect with your patient and be a patient advocate. I think one of the other misconceptions is that to become a nurse you have to stop your life and go to school full-time to become a nurse. So if this is a second career for somebody, I think it's important to know that that's not necessarily what has to happen. There are so many programs that have flexible schedules and that you can still continue to work full-time or work part-time and go to nursing school. After you complete your nursing program, you go through the test called an NCLEX, and it's your state boards, basically. And whether you graduate from a 2-year program or a 4-year program or an accelerated program that finishes even sooner than 2 years, it's the same test. If I had any advice for test takers now, it would be to try to schedule your test as quickly as possible after nursing school while everything's fresh, and to prepare for a test that's potentially 225 questions that could cover 90 different specialties in nursing. You might have OB questions, you might have peds questions, you might have cardiac questions. It's much easier to take the test when the information's more fresh. Prior to becoming a nurse, this was my second career. I was in marketing, sales, and advertising, and it was a great job. It paid well. I had lots of time with my family, but at the end of the day, I didn't feel like I really made a difference. In the nursing world, it's a good day when you leave feeling like you made a difference for somebody, and it might be something really simple, like you had an extra 15 minutes that you were able to talk to your 80-year-old patient and you're their only social contact for the day, and you got to learn about their grandkids, and that made a difference for them. On one hand, that's really, really rewarding. And on the other side, nursing is so flexible. There are so many different jobs in nursing, there are so many different specialties in nursing, there's so many different schedules in nursing, so you're really afforded an opportunity to have a good work-life balance, and that's not true in a lot of careers.
Visit Petersons.com, your resource for nursing programs, scholarship applications, and NCLEX test prep.